Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
While you may not qualify for senior discounts yet, you don't have to wait to get older to start the fight against getting old. You can start at any age by taking a few steps now to take care of the skin you're in so it will last you a lifetime. On this edition, you'll hear from skincare experts on skin do's and don'ts. I'm Janet Whitmoyer, your host. Welcome to Healthy Living for Life, a show designed to help you do just that. Stay tuned. My first guest is Kara Addison, a doctor of nursing practice specializing and certified in dermatology at the Associated Dermatology and Skincare Clinic of Helena. Welcome, Kara.
Thank you.
Let's start off by talking about prevention of sunburn and skin cancer since summer is here. Can you give our viewers some tips on that?
Absolutely. So with summer quickly approaching, the first thing the majority of us think of is sunscreen. The number one question we get is what SPF are we looking for? What type of protection are we actually looking for in those sunscreens? And so broad spectrum is the most important. The American Academy of Dermatology recommends 30 SPF. However, if you are lighter skin, we do recommend 50 and above for a little bit more protection. Also looking for zinc and titanium are the main type of chemicals that we're looking for as well. Using protection type of clothing, using hats, even UPF protective clothing, which they are actually coming out with some pretty good looks out there. And also seeking shade, especially between the hours of 10 and 4. We really do find that that's the time that we do get sunburned, and reapplying that sunscreen every 2 hours, which is usually where it gets us, are probably the most important things to think about this summer.
Okay, great. So are fair-skinned or lighter-skinned people more susceptible to sunburn and sun damage, or are there people with genetic predispositions to getting sun cancers?
So that's actually a great question. We do get that quite often, wondering, do my genetics have a play in this? And so yes, they do, especially with melanoma. So there's 3 main types of skin cancer: melanoma, squamous, and basal cell carcinoma. The sun increases the risk of all of those, but heredity as well. So if you have a family member that has melanoma, you have about a 40% increased risk of getting melanoma in your lifetime. About 1 out of every 10 people actually have that genetic risk factor where they had someone else in their family who had melanoma as well as them. Looking at things, I would probably say like basal and squamous cell, we do have a higher risk if we're lighter skinned because we have less melanocytes. And those are the cells, our pigmentation, that help protect us against the sun. But with having less of those, we're unable to protect ourselves and not able to be out in the sun quite as long without getting a sunburn.
Okay, so speaking of being out in the sun, can you tell us how the sun, or what we hear about the UV or ultraviolet rays, actually damage our skin?
Right, so we have UVA and UVB, which are both harmful to the skin. What happens is those sunburns we get, especially between the ages of 0 and 20 usually, in addition to later on in life, have a long-term effect. So when those rays hit our skin, they actually cause some mutations. And so our skin reproduces every 4 to 6 weeks. And those centers that reproduce our skin can get those little mutations over time. Most of the time our body can take care of those, but over time we don't have the same type of function, and some of those mutations will escape, causing skin cancer. Not only does it increase your risk of skin cancer, but also we lose our subcutaneous tissue as we age, and that makes the process go a lot more rapid when we have that sun damage.
Okay. Speaking of aging, I wanted to shift a little bit to dry and itchy skin. A lot of times seniors especially experience that. Can you tell us some things that people can do to help prevent that type of itching that goes on for them?
Absolutely. So whether it's winter itch or summer itch, people experience it at different times or all the time. It's called xerosis, so it's a chronic condition where we don't have the hydration in our skin. And especially in Montana, with the lack of humidity, we're all experiencing that. So different things that we can do for it is hydration, usually drinking about 8 glasses or more of water, which can be challenging, but trying to make that a habit is going to increase our barrier to the outside. Also using moisturizing moisturizers that especially don't have scents. Usually scents pull that moisture out of our skin. And so doing a daily moisturizer, especially right after the shower, is fairly effective.
That's great information to know. What about nutrition and vitamins? What role, if any, do they play in helping to alleviate dry and itchy skin?
So vitamins and minerals have definitely quite a few different ones that help different aspects of the skin. Especially when we talk about moisturizing, we think of omega-3 fatty acids. Those are important to help bind those molecules, our skin cells together, so we have a functional barrier. Different things for helping with aging, wrinkling, things like that would be antioxidants. So vitamin C, vitamin A, vitamin E, beta carotene, so things that we even find in our fruits and vegetables as well. Topical vitamin K can actually help kind of reduce some of the pigment changes that we see over time as well, sometimes even helping with bruising. And so those are a good kind of overview of things you can introduce or keep into your diet.
You said something about aging and the pigmentation changes in the skin, and that brings me to the issue of liver spots. We've heard of those. Should people be concerned if they have liver spots? So liver spots are one of the #1 things that we do see, and as we age, a lot of us get those, especially with our sun exposure in Montana. They're actually called solar lentigos, which I think sounds much better than age spots or liver spots. But what these are is they're areas of chronic sun damage. And so when we get those UVA rays, the melanocytes kind of come together, causing these larger brown spots. And so what we can do for that is really protection from the sun. These are usually normal for the most part. However, if they start to get red and scaly, have an irregular border or black flecks, it's usually good to go get those checked out. Okay. We only have about 30 seconds for one final question, and I wanted to ask you about skin tears. Yeah. That's an issue that older people usually have problems with. Can you tell us a little bit about what problems or what concerns seniors should have about skin tears?
Absolutely. So 3 different types of skin tears. When we do have an initial skin tear where there's a flap but no actual loss of skin, we call that stage 1. You want to actually bring that flap of skin, wash it with soap and water, and bring it back over, usually covering with a little Vaseline, and then covering it with kind of a Band-Aid just for an occlusion to keep it protected. Usually doing that, you want to make sure there's no adhesive around that flap so you're not pulling it off. If you have a 2nd-degree type tear, usually we've lost part of that flap, but you still want to try and reattach it. Put moisture such as the Vaseline and then cover and protect it. Gauze and Coband is perfect, and the stage 3 would be the full tear, and probably go and see your primary care provider or your dermatology provider.
Perfect. Well, thanks for the great information and super tips, Kara. We'll be back right after the commercial break. Welcome back to Healthy Living for Life. Our next guest is from Missoula's Community Medical Center, Dr. Charlotte Kutsch. Dr. Kutsch is a board-certified dermatologist at the Family Dermatology Clinic. She practices medical and surgical dermatology and enjoys seeing patients of all ages. Dr. Kutsch, thanks and welcome to the show.
Thank you.
Let's start off by having you tell us what really spurred your interest in dermatology.
You know, I became interested in dermatology while I was still a medical student. And as a medical student, I was able to actually get involved in some research, and I did some research on the microscopic anatomy of the skin. And I just thought it was so interesting how what I saw in the dermatology clinic was really backed up by science of what was happening in the laboratory and in clinical studies.
So speaking of the skin, can you give the viewers somewhat of a breakdown of what the skin, the physiology of the skin and the different layers of the skin are?
Well, you know, the skin, although it has layers, it is a very dynamic organ. And there are 3 layers in the skin. There's the epidermis, which is the outer layer, the dermis, which is the mid layer, and the subcutis or the hypodermis. And all of the layers of the skin are alive, they're active, and they're integrated with each other, and they help the skin to perform its different functions. You know, it's very interesting because the skin not only has to protect us from the environment, we have to be able to interact with the environment and with each other as well. And so all of the functions of the skin with the protection from infection, from ultraviolet light. It has to delivery of medications have to come through the skin in many instances. And temperature regulation, fluid regulation through sweating, those are all important functions of the skin.
And that's really good information. I wanted to key in just a little bit more on the outer layer, the epidermis. As we get older, we know that that layer gets thinner. Can you tell us why that happens?
The epidermis thins out through the adult years. So from the ages of 30 to 80, we will lose about 50% of the thickness of our epidermis. A lot of that has to do with the cells themselves. They become more compact, and we lose water, the skin's ability to retain moisture, and we also lose the ability to retain the healthy fats or lipids. And it's the moisture and the lipids that really make the skin cells plump and thick. So that ability just decreases through the years.
What other things happen to our skin as we age, besides just the thinning?
You know, you may be aware that, the skin seems to tear very easily. So the skin becomes less elastic, and you'll find that sometimes people will say that their skin seems to tear. It doesn't stretch as easily as it used to. And the temperature regulation is a very big deal too. You know, I recall my grandmother always walking around with a sweater on. She was always cold. And the ability to regulate the body temperature comes through the skin, and that goes down through the years as well. Wound repair, that also decreases through the years.
There's an awful lot that's going on with the skin. So can you tell us at what age, or is there an age when somebody should really think about starting to see a dermatologist on a regular basis?
Absolutely any age is the right age. Of course, I see patients of all ages. A lot of patients will come in to see me when they have a big birthday. That seems to be the trigger. And they'll start looking at their skin. They might notice new spots. They'll notice maybe new skin growths that they're concerned about. So they'll come in to have a screening, and that's very wise. I will see a lot of teenagers and young adults. In that age group, maybe they're struggling with complexion issues, rashes or warts. And then I can see a lot of children, and sometimes they are born with certain conditions of the skin that need to be evaluated, but also if they have a family history of skin cancer, or if they have a condition that runs in their family, their parents will bring them in to have them evaluated.
Can you tell us a little bit about the different types of skin cancer, what's most common and what's most dangerous?
So the three main types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. And people who are most at risk for these types of skin cancer are persons who have maybe a really light or fair complexion, persons with blue or green eyes, and really fair hair or red hair. But these aren't the only people who are at risk for getting skin cancer. We also know that people who have had heavy sun exposure through the years, or a history of sunburns, or a family history of skin cancer, these are people who are at risk as well. And the skin cancers themselves, basal cell is actually the very most common type of all of the skin cancers. And over 75% of all of the skin cancers are basal cell carcinoma. The melanomas make up far fewer skin cancers. However, 75% of the skin cancer deaths come from melanoma.
Okay, so I have time just for one final question, Dr. Kutch. If someone thinks that they might have skin cancer, what should they do? Is it important for them to get in right away, or do they have some time to seek treatment?
Certainly we recommend you get in as soon as possible. I think a 1 to 2 week time frame is very reasonable, and I think that's why it's very good to have an established relationship with your doctor or dermatologist. And that way, if you do have a spot that you think needs to be checked quickly, it's easy for me. We can fit you on our schedule very quickly just to get one spot checked.
Okay, great. Thanks for the great information. We'll be right back with more from Dr. Kutch after the break. Stay tuned. Welcome back to Healthy Living for Life. We are continuing our discussion with Dr. Charlotte Kutch. Dr. Kutch, I read that tanning beds are a real big cause of skin cancer, in particular melanoma, which is the serious kind. Can you tell us why tanning beds are so dangerous?
You know, the scientific evidence and the consensus of the medical community agree that tanning bed use actually increases your risk of melanoma. We have no doubt about that link anymore. And we also know that it relates to how many sessions you've had in the tanning bed, over how many years, and how often you use it. And even more importantly, we know that the younger age that you start, the even higher risk that you have for melanoma.
Okay, so speaking of age, is there an age at which people are more vulnerable to getting skin cancer from using the tanning beds?
Yes, we know that the most dangerous pattern of use is when patrons of the tanning bed start under age 35. We know that that younger skin is the most vulnerable. What we know about ultraviolet light is when the ultraviolet light hits the skin, it goes directly through the skin cells into the DNA. And the DNA of your skin cells are affected by that light, and it actually triggers a repair mechanism. Once the ultraviolet light hits, your body starts trying to repair its own DNA. And so because of this, we know that the younger ages, that DNA is even more vulnerable. And so the more times that you're using the tanning beds, it can be even more destructive to the DNA. And so that's why through the American Academy of Dermatology, we say no tan is a healthy tan.
Good advice. So what do you tell your patients in addition to that are using tanning beds?
Well, certainly I encourage them to stop, and I do encourage them, if they like to have some color on their skin, that they should use the self-tanners, so the cream self-tanners, or to get a spray tan. And we don't have any known health risks of those products. As long as they don't eat them or inhale them, they should be fine to use. And so we feel like that would be a nice alternative. And, you know, as Americans, we like to feel like we can do, it's a free country, we can do whatever we want. But again, we learned very early on that its use of tanning beds is like tobacco. I mean, it is a carcinogen and it's very, very harmful. And so we really want to encourage patients not to use it. And in fact, there are many countries, for example, in Europe, Spain, France, Germany, Austria, Belgium, and even parts of Canada and parts of Australia that have completely banned minors from using tanning beds, meaning minors under age 18. And so we would really like to see more of the United States, more of the states enacting similar legislation.
Well, and speaking of legislation, we know that this issue has come before the Montana legislature since as far back as 2009, and all of the bills have been defeated that would regulate the tanning beds for minors. If tanning beds were restricted or prohibited, what kind of difference would that make in the fight against cancer?
It would make a very big difference. And a recent study that came out from the CDC, or the Center for Disease Control and Prevention, had a wonderful conclusion, and they showed very clearly that if minors under age 18 were prevented from using tanning beds, that we would have significantly fewer melanoma cases in the future, and we would have a corresponding reduction in costs. So we have all the scientific evidence that we need to really encourage people not only to stay out of the tanning beds, but also to really enact legislation to do so. And I just encourage teens to stay away from tanning beds, even though we don't have a law there yet. And also I encourage people who maybe were touched personally by melanoma, or people whose family members have been touched by melanoma, contact your legislator and ask them to enact meaningful legislation that will really help to keep teens out of tanning beds.
Awesome. Thanks for the great information, Dr. Kutch. Our next guest today is Barb Flynn. Barb understands the importance of being vigilant about regular skin checks. So Barb, tell us about what precipitated your first visit to a dermatologist.
Well, I was reading an article about skin cancer, and it made me think about some freckles that started out as freckles but continued to grow and were getting darker and darker. And I also had a small freckle on my thigh that looked a little different than the other freckles. So I did make an appointment with my dermatologist, and I had to go back to have the one on my thigh removed, and it was quite an extensive removal. It was about 2 inches long, half an inch wide, and very deep, and it was cancerous, the portion he took out. The ugly freckles, they were seborrheic keratoses, more ugly than dangerous. I still have those checked out. They still grow, and I still have other parts removed.
So that really set your stage for getting to the dermatologist. How often do you see your dermatologist?
I have a standing annual appointment with my dermatologist. I don't believe I've missed an appointment in 30 years. I've had many abnormal growths removed. I've had more than a dozen precancerous patches removed. I just keep going on.
Well, and that's awesome. But I'm guessing you didn't start that when you were young. When did you first, were you a sun seeker when you were a young person?
No, I wasn't a sun seeker. I knew I burned easily, so I didn't invite more sunburns. Not like my girlfriends, they were sunbathing constantly, slathering baby oil, trying to get that perfect tan, sunbathing every day. However, I was pretty much an athlete, and I was outside most days during the summer and other good weather, so I had an opportunity to visit the sun.
So just very quickly, could you tell us what advice you would give to our viewers who also might be in the same position that you're in?
If you see something abnormal, go find a dermatologist, make an appointment. It's my experience that they want to get you in, they want to see you quickly, and melanoma is nothing to even play with. Just go in, have it taken care of.
Thanks. Great advice, Barb. I want to thank today's guests and hope that you at home have learned how to protect your skin so that it will last you a lifetime. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. See you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.